great pleasure to be here. In fact, we feel that our partnership, that is the IOM and now known as the NAM, I'll tell you about this, this partnership and this initiative is really one of the most important things that we have done. So we're very, very pleased to be here today. And in fact, what I would do is really frame up the whole meeting, particularly as it relates to what we have found in the first report. And of course, I'll introduce our committee members who will tell you about the second report and how all this is coming together to make a big difference for the nursing profession. Now, when I was preparing for this, I had a number of conversations, and someone says, well, many nurses may not know who IOM is. Do you? Let's see a show of hands. Well, I don't have to give my first part of my talk. But you may not know about why we call ourselves now the National Academy of Medicine. So if you bear with me, I'd just like to tell you a little bit about ourselves, how we got to where we are, and how we got involved, in fact, with this very exciting initiative. Who's IOM? Well, IOM was the health arm of the National Academy of Science. And our parent organization, the National Academy of Sciences, was actually founded by the US government. Abraham Lincoln signed into existence with Congress, charter NAS. And the idea at the time was that the country needed an independent, highly comprehensive set of experts to give advice, in fact, to the nation on issues of sciences. Now, we all know how important health is. So about 45 years ago, some 100 years after the founding of the National Academy of Science, it was felt that we need a health arm of the National Academy, hence the creation of the Institute of Medicine. And of course, Institute of Medicine in the last 45 years has played a critical important role as an independent advisor to a nation, not only in response to government needs, but also response to what I think the public needs, your needs, which is why I think we're so proud to be involved with the future of nursing. Now, in that context, the Institute of Medicine, I want to make sure I'm not, okay. So as of July 1, 2014, we reconstituted the National Academies so that the IOM is now a National Academy itself, hence called the National Academy of Medicine. Although we call National Academy of Medicine, I don't want you to say, have this name, fool you to think we only focus on medicine. We are about health. It's a much broader mission. And I want to make sure you get that message. And there are many different reasons why we use this name for internal purposes, and etc. But I want to be here today to tell you we're about all health professions. And we're particularly excited about working with you. And it's about advancing health and improving, in fact, the status nation. So the culture of health, in fact, is very much something that we embrace, and very much that we're so lucky to be partnered with RWJ. So if you look at the next slide, I think that we have certainly gained the trust of the public as well as of the health profession and the government. As you've seen that, the most cited journal, which is the New York Times, says we are authoritative and independent advisors. So that being said, what I'd like to do is to talk to you a little bit about what we do. There are two things we do really well. One is to convene the world's greatest experts around a specific topic. They're here to give us independent advice, and then to come together and talk about the directions, issues, challenges to work together. This is called roundtables, forums, and many of, in fact, of your colleagues serve on these forums around table. The second is to create reports, such as the one you're going to hear about. In fact, that as I think, write the book on any issue. That is because we do it so independently, so extensively. It usually takes us over a year to do a single report with consensus. That these recommendations are our recommendations, and frequently, because our work is also commissioned by Congress, by US government, and by global governments, they are the recommendation for policy, for legislation, for law, etc. So in that context, I would say that these are the areas that we've been working on. We'll work on things like uniting public healthcare systems. Our report says, really, public health and healthcare delivery should not be in two separate parts of the community. It should be coming together. That primary care, through primary care and working with public health, we can make a huge difference to health and well-being of our community. We look at social determinants of health, something I know you care tremendously about. I certainly believe that that is, in fact, the root of almost everything that we do, that if we can attack these things, we'll end up with a much healthier society. On the issues of health equity, something, again, that I know you care tremendous about. On health professional education, and we advise FDA and the government on air regulation, and many others, which I would not have time to talk about today. So, we are so proud of our relationship with you. We have a long history of relation with nursing. For example, we have a nurse scholar in residence program, which was initiated in 1982, which will provide year-long leadership opportunities in health policy. So one of your colleagues are chosen each year, will spend a year with us, and in fact, within the US government, could be in the White House or in Congress or other branches of government, and they will actually walk through health policy. And this year, Susan Bacon was chosen as our 2015-2016 scholar. And of course, there are many nurses as members of a very elite and elected membership, and we're very proud of it. And in fact, they play many leadership roles, including in our council, which is equivalent to my board of directors. So Sheila Burke, Martha Hill, many others. But I think one thing that we're particularly proud of is the fact that the highest award, highest order given at the National Academy of Medicine, IOM, is the Gustav Linhart Award. And of course, last year, Linda Aiken was honored with this highest level award. It's wonderful. And if you look at, for her, for illuminating evidence that shows how nurses can improve the quality of health care and for informing health practices policies related to nursing. So you can see that our organization serves you, serves everyone in order to improve health of a nation, health globally. And we want to work closely with you. So, I'm asked to say a few words about where we're going now that we are in the academy. My feeling is that there are three goals. One is, first, we have to listen to you and the public. We not only serve the government, as was the founding charter, but we serve the nation, which means that the public matters, you matter, and what are those critically important issues that we need to tackle. We will do so. I want to give you an example. Last year, we released a report on end-of-life care. How many people heard about our report? There you go. You heard of the death panel, right? No government would say, hey, IOM, go and do a report. We actually, at the urging of different people, took this on. And of course, as you know, this report has great impact. And as recent as in July, CMS says, yes, we will start reimbursing health providers for spend time with patients and discussing about end-of-life care, preparation. So that's a great example. Thank you. Thank you. We want to work with you to think about what to expect in the future of health and healthcare. The culture of health, of course, is such an important initiative, and we're working in partnership with the Robert Wood Johnson, and of course with my good friend Risa Lavisa-Mori, that I've known for a long time. So I'm so pleased that we are asked to work with you again. But in this second goal, we recognize that we'll have a new US administration. And in fact, we need to start working towards what's in the future. How do we advise the next US administration? Whatever party, whatever the plan is, there are still gaps in our health care systems and health systems that we need to work on. So we're working on a series of, in fact, positions and papers in order to get ready to advise the next U.S. administration. And finally, we believe as a leader of health and healthcare, we have to be people who inspire the nation and therefore curate great audacious ideas with all of you to say, how can we work together to make a difference, to get to the moon, a moonshot. So working on these ideas, grand challenges. So let me talk about something that we're so proud of, which is, in fact, the Future of Nursing report. I'm sure you all know that in 2008, the Robert Wood Johnson Foundation and the IOM launched a 2-year initiative to assess and transform the nursing profession. And it was an action-oriented blueprint for the future of nursing. And that's why it has, as I'll tell you, tremendous impact. And then with AARP and Robert Wood Johnson, the campaign, we're moving the needle. But we need to do a lot more to get there the way that it should be. So if you look at the 4 key messages, it says first, nurses should practice to the full extent of the profession, right? Absolutely. Nurses should achieve high levels of education and training through an improved education system because the data shows clearly the more education, higher learning, the better is the outcome in healthcare. That nurses should be full partners, and I believe it, partners with physicians, with other healthcare providers, with policymakers, and in redesigning healthcare in the United States. And I know that's what you want to do, and that's what you're doing. And effective workforce planning and policy making require better data collection, which is really a very important thing that, in fact, came out of the report that I'm sure will be discussed about. How do we collect the right information to make the right decision, and therefore we can know what to do in the future. Now, specifically, actually the recommendations to me are very bold. You know, if you look at recommendations, not only removing scope of barrier practices, but in fact provide opportunities to nurse to lead and diffuse collaborative improvement efforts, implement a nurse residency program. Now, medical side has GME. Nurses need a GNE, right? But also to say, look at this, increase the proportion of nurses with baccalaureate degree to 20% by 80% by 2020. Sorry. I was going to say 80, no. Double the number of nurses with a doctorate by 2020. Ensure they engage in lifelong learning. Prepare, enable nurses to lead change, advance health, and build an infrastructure. So I just talked about that. I think the boldness is setting the bar really high to say we need a lot more people with baccalaureate degrees, with PhDs, with doctor of nurse practice, etc., in a short time frame. So this report, I can tell you, is the most downloaded report ever in the history of IOM. I'm going to read you some statistics. On the day of report's release alone, the website received 11,000 site visits. Now remember, that's 2010. That was a record-breaking number for us. Now, today, of course, it's unbelievable. If you look at the e-book version of the report, it's been downloaded over 200,000 times. Unbelievable. And the suite of Future of Nursing products in IOM website has cumulatively received 1.1 million page views. I think it just goes to show the time is right, the message is right. We're going to look at it, and we're now going to do something about this. So success is not, of course, reflected by these numbers. Success is what we do in action, in implementation, and what are we doing in impact. So in that regard, you heard that, in fact, AARP and Robert Wood Johnson Foundation partnered together to launch this really important Future of Nursing campaign for action. And in fact, their goals, as you heard, are to advance the education transformation, leverage nursing leadership, remove barriers to practice, promote diversity, and foster interprofessional collaboration. So a big part of what we've been asking is what's happened? And you're going to hear from the committee members about their assessment, but I think these are some numbers which are already known publicly, which is that, in fact, we started moving the needle. Today, there are 21 states, including District of Columbia, that give full authority, practice authority to nurse practitioners. Along the way, I think it's wonderful. At least 8 new states joined, and a whole number of states are also expanding the possibilities. And so we're moving there, but not quite there yet. Education. If you look at that short time, and I was a chancellor at Duke University working with Catherine Gillis, our dean, we see this tremendous interest and expansion of people enrolling in nursing school. And you can see the number. BSN enrollment increased 53% in 3 years, and the DNP program graduated almost twice the number of doctors of nursing practice in that short time. Very impressive. Also, PhD program increased by 15%, and of course, graduate medical, graduate nursing education. Secretary Sebelius kicked off this GNE, in which Duke was one of the 5 centers. So we're moving. We need to make sure it's continual and sustained so that nurses, after their education in undergraduate, have the opportunity to have their residency program to scale up to, in fact, much greater future opportunities. And finally, interprofessional training. I think we all recognize that teamwork is what it's all about in patient care, and we've seen many interprofessional training programs that's being developed. So I say that time is now. And the good news is with the ACA, there's even much more crying for the need for primary care, the need for nurses to play a much bigger role. And in fact, with this report, with the campaign, with the ACA, I think there's going to be lots of opportunities for us to move the needle. And as you see it, new payment models, new education paradigm, and others. So, what next? So we were asked in 2014 by Woodward Wood Johnson Foundation again to say, help us assess the progress of that report. And also, let's take also a look at where we are with the campaign. And so you're going to hear from some of the leading committee members who are here. It's chaired by Stuart Altman, who can't join us today, but Dr. George Thibault is here, and others whom I will introduce. And of course, they were asked to look at the charge committee, which is to assess the change in the field of nursing and also peripheral areas over the past 5 years as a result of the report, and also the campaign will take into consideration to assess these changes. To assess the campaign's progress in meeting the stated goals and identify the areas that should be emphasized over the next 5 years that help the campaign to really realize the full recommendation of the IM report. And to provide conclusion recommendations, what actions to take to ensure sustainability of the impact of the campaign and its work. So you see this link here for this report. You can read the full report in brief, release slides, and also we release a webinar as well. So I think that what I'd like to do is to say the committee has done tremendous work. They're given a charge to do their work, to look at where things are. They asked not to go back to the recommendation, but stick with the recommendation, because we're not re-examining that, but more importantly, how are we doing, and what do we need to do in the future? I think the committee concluded that campaigns make great progress, as you hear, in many aspects of work. Short time, I already showed you some of the data. I think they certainly have shown you, they'll show you a lot more of an action coalition that is organized. It's certainly met or even exceeded the expectations, but we all recognize there's more work need to be done. And the work to be done found that 3 themes should drive the work of campaign. Need to build a broader coalition to increase awareness of nurses' ability to play a full role in health professions, the need for increased priority on promoting diversity in nursing workforce, and need for better data to assess and drive progress. They have 10 recommendations you'll hear. So with that, I want to thank you for allowing me to kick off the meeting and tell you about this very important work that we're all doing together. I look forward to working with all of you in the future.